Good morning. I'm George Latimer, Westchester County Executive. It's Thursday, April 23rd, and we're here for our morning conversation during the coronavirus outbreak. Today, our conversation is going to be with Dennis Delborgo, who's our Director of the Office of Emergency Management for the county. Dennis is the person who's in the middle of every bad thing that you can think of happening. He has to be available to think about it in advance, plan for it. If it's an incident at Indian Point, if it's bad weather coming in, hurricane force winds, if we lose power, Dennis Delborgo is the guy in the county that's at front and center on it. So Dennis, thank you very much for being with us this morning.
And good morning. Thank you very much for inviting me to join you today and to have this conversation so we can educate the public a little bit more about what we're doing here at the Office of Emergency Management and in the Emergency Operations Center.
Well, we appreciate that. You and the team that reports to you, obviously our Commissioner, John Cullen of the department. Tell us, what does an emergency manager do? And in this particular pandemic, what has been your role?
Sure. So the majority of emergencies are managed very effectively at the local level by our local incident commanders, such as our fire chiefs, our police lieutenants. But as the situation escalates or is having a countywide or regional impact, then an emergency manager like myself or someone from my team may be engaged to assist them. So as an emergency manager, we have advanced education and training in incident management, emergency services, or public safety experience. We have many firefighters, EMTs, law enforcement officers. The emergency management office will assist the incident commander with developing a structure appropriate for the scope of the incident so that we can manage a multi-agency response. We're often called upon to troubleshoot solutions to big problems, and problem solving is a big part of our profession. For the coronavirus outbreak, the county's emergency managers and other personnel from the Department of Emergency Services, we've been working to support our partners over at the health department, who are really focused on the operational aspects of the response, that real boots on the ground work, like contact investigation, field specimen collection, quarantine and isolation, and all those essential operational issues that we need to address for the outbreak. As emergency managers, we work behind that scene primarily on planning and logistics. So that may include status reports for situational awareness, developing plans for the following day, or attempting to source needed equipment and supplies, whatever our partners may need. And we do that through the Emergency Operations Center, or the EOC.
Well, can you describe exactly what the EOC, the County's Emergency Center, does in a function like this particular event, this being different from other kinds of emergency activities?
Sure. So the EOC functions primarily as a countywide clearinghouse for everything our local officials and our other stakeholders may need to effectively respond or recover to any major emergency or disaster, including the current COVID outbreak. That includes processing information, intelligence, requests to deploy personnel, equipment, or supplies to meet whatever mission requirements may be presented in a particular village, town, or city. This is all accomplished through multi-agency collaboration across many county departments, partnerships with New York State, federal government, the private sector, and certain NGOs, non-governmental organizations. And down here in the EOC, everyone loses their identity when you take on a role in the EOC. It may very well have little to do with what you do on a day-to-day basis, but we're employing those skill sets of those individuals that are assigned here as a manager, a planner, a logistician, or a subject matter expert in a particular field. And we're very fortunate to have a lot of dedicated county personnel who have stepped up to the plate here and worked down here in the EOC, including many volunteers, our Westchester Medical Reserve Corps volunteers who are staffing our call centers and communicating with the public. COVID has presented us with some really unique challenges with respect to how we conduct our work down here. Coastal storm or hurricane, we may have over 100 personnel from dozens of different agencies operating in the EOC all at the same time. But to accommodate social distance seating, we've reduced our staffing levels and we're allowing virtual participation remotely for folks that would normally be down here with us. So the staff work in masks. It's been a learning experience, but we've been at this for almost 2 months now, and we've learned a tremendous amount during that time. And the operational tempo here is the same as it would be during, say, a major blizzard. The only difference is it snows 24 hours a day and the snow never stops.
Well, that's, what strikes me as something that makes this very different from the few issues that I've dealt with during my 2+ years in this job. And in general, over the course of, our living in this county, we had Hurricane Sandy, we had Superstorm Sandy, Hurricane Irene. those were events that happened in a distinct period of time and then ended. 9/11, the tragic event, and there was, the clearing away of the pile that happened after the day. But the day event was a singular day. And the same could be said of the experience that I had in the first few months of my tenure when the windstorms throughout the county, particularly the northern part of the county, blew out power lines and kept many people without power 4, 5, 6 days. But none of these things were a month in duration, 2 months in duration. And as we sit here today in now late April, they're open-ended in terms of time. We don't know when they're going to be resolved to a level at which we resume normalcy. And I think we all want to see resumption, but we don't know when that's going to happen. So this makes it like an ongoing emergency that has no time frame end to it. It keeps going day after day after day. Let's talk about some of the missions that you're coordinating in response to this crisis. We're certainly very familiar with your coordination of requests from local governments, and that is an ongoing issue. We hear, obviously, when there's need, not necessarily when the need has been met. So tell us a little bit about what you're dealing with.
Sure. The pandemic has been a real unique experience for us in terms of breaking out of the normal process and procedures that we would normally follow for, say, severe weather or a simulated emergency at Indian Point. Typically, our customer is a local official, a mayor, a town supervisor, village administrator. For this event, we've been talking directly to the first responder and the healthcare community, firefighters, police officers, EMTs, hospitals, nursing homes, folks that provide home care services, services to people with disabilities, and even for this event, we've had to engage directly with funeral directors on some of the issues that they've been encountering. One of our largest areas of focus has been sourcing personal protective equipment, or PPE, for our first responders and our healthcare workers. So for the last 2 months, that's been very challenging for us to accomplish something that only 2.5 months ago, you could have went online and ordered an infinite quantity of PPE and had it shipped here overnight. Now those same orders are allocated at just a few percent of the total amount of product that's needed out there in the field. It's costing us a lot more, and it's taking weeks to ship. So where we come in the EOC is we're able to work with vendors, the state of New York, sometimes with the assistance of the federal government, to obtain these items in large quantities and distribute it countywide based on actual needs to meet what we call the PPE burn rate. So our staff in the EOC, we stand right behind our healthcare providers and our first responders. Those are the folks who are out on the front lines doing this critical work. And we do what we do every day so that they can keep doing what they do every day out there in our emergency rooms and out in the field. So the dedication, the commitment of the staff here in the EOC to that mission has been unwavering and absolute, despite the fact that we've been down here for almost 2 months now. The staff are more committed than ever to achieving that mission. And somewhere in Westchester County, we're proud that a nurse is wearing a piece of PPE that this team here in the EOC was able to obtain for them by working 12, 14-hour shifts, 6, 7 days a week. And we're going to keep doing that until we weather this crisis. We're all in this together, and these folks are making a lot of the same personal sacrifices that everybody else is making.
And I should say, as Dennis describes the EOC, which is one component, we're going to talk in a second about the warehouse circumstances for the emergency support services. Dennis is physically in an undisclosed location, mid-county, and is down in a sub-basement environment, but it's very well apportioned for the purpose at hand. When we talk about the need to social distance, it generally is structured, the main room, the way you would see a telemarketing boiler room. I did a little bit of that in my younger years when I needed a second job at night. And you're sitting at a workstation in close quarters to other people, and there would be representatives of utilities, of various other agencies, local agencies, larger agencies, and depending on the nature of the crisis, you put all hands on deck in order to be able to deal with problems instantaneously with representatives from each of those entities. And then there's I don't know how you officially call sort of the room with the conference table. I view it as probably what the Situation Room is in the White House on a smaller level, with television walls that you can have senior management around the table making decisions in real time and being able to look at geographically what's happening all across the county. And it's a little sobering, when you sit down there and you realize, certainly in the position that I have, that you're making decisions that can affect 1 million people. And of course, that is nothing to take lightly. So where Dennis is right now, what he deals with every day is being prepared for moments like this to the extent that you can be prepared. There is the warehouse. I was there last week. I had a chance to walk around. To me, it looked like the shipping dock area of any major corporation that I'd ever had reason to visit or be with. There are boxes, in this particular case, of PPEs and other equipment, hand sanitizers that are there, and there's a constant movement in and out of product coming in and product going back out. How does that entity function vis-a-vis the EOC?
Like you said, this event has really been an all-hands-on-deck response. We have a lot of dedicated personnel who have stepped up to help support that warehouse and logistics operation. The Emergency Support Services warehouse, the facility you visited last week, really functions as an extension of what we call the logistics section here in the EOC. That's a handful of professionals that are working to source the PPE and a lot of the other items that we'll need to support our responders out there in the field. They're truly behind the scenes at the warehouse. They're doing the important work of ensuring that the items that are being requested by one of our customers are in stock, ready for deployment, and if they are, then we arrange for those items to make it that last mile to where they're needed as soon as possible. Everyone there knows that a medical gown, a face mask, an N95, or a pair of goggles doesn't do anybody any good on a shelf in our warehouse. It does the most good in the hands of a doctor or a nurse or an EMT, and the logistics section is literally doing the heavy lifting to make those things happen for us.
Now, we're using the acronym PPE second nature now, and I don't know how much in the general public everybody uses that acronym. I have frankly never heard of that acronym until fairly recently. It stands for Personal Protective Equipment, and it represents, as Dennis just said, the gloves, the masks, the visors and shields, the gowns, a host of things that a medical professional or anybody that's involved with potential contact with a COVID patient, is also used in other contexts as well, that they must don in order to interact with that individual, because the threat of contagion of this disease is tremendous. I mean, it's easily transferred in the air. It does not it does not require contact. You can touch a surface that has the virus on the surface, and it doesn't look any different than touching a doorknob or a table, and you can contract the virus from that situation. So having the personal protective equipment on is an absolute necessity if we want our healthcare professionals to deal with the people that have come down with the virus, and to avoid the healthcare professionals from coming down with the virus, to avoid the firefighters or the EMS workers that respond to a call in a community, and that individual would then contract the disease while they're even trying to help other people. But it really represents a logistical nightmare in certain ways, Dennis, that is put at the doorstep of your department. What are you doing to address all of those challenges?
Well, we certainly want to work as hard as we can to get our nurses and our doctors, our healthcare professionals out there doing this work, everything that they need in a timely manner. That has posed some significant challenges for us for this event. We're navigating some very uncharted water, and we really exposed some weaknesses in the supply chain for some of these critical items like healthcare worker PPE. In all fairness, a global pandemic will always on our radar in terms of the county's hazard profiles presented in the past a substantially lower risk than, say, a severe weather event that we experience on a regular basis. But that does fall into the category of a low probability, high consequence event, which we're experiencing right now. So the county did have a stockpile of PPE for just such a contingency in accordance with our plans. But however, that stockpile was rapidly depleted in the first week or so of the pandemic. And this is due really to a combination of factors, such as the international nature of the event. It's happening globally, and we're all in competition for the same items versus, say, a more localized outbreak that we may experience from time to time. That extraordinary demand simply cannot be met by the existing manufacturing capacity, as well as higher burn rates. The people that are out there that need this PPE are simply using more of it, and we need to try to replace those items as soon as we can. And unfortunately, over the last several weeks and months, the burn rates are higher than the rate at which we're able to source replacements. So we work on some of the solutions to those issues. Since we first started managing the pandemic, we received over 1,000 requests for resources and fielded thousands of phone calls and emails. Over 50% of those are for medical supplies, PPE, and other items. The balance has been for assets such as tents to allow hospitals to screen patients prior to entering the emergency room, traffic control equipment to be used at drive-through testing sites, mortuary supplies to assist funeral services, among many other items. So we're addressing these shortfalls a number of ways. Education, by ensuring that our healthcare providers and first responders are aware of the CDC recommended conservation methods. So we're making the best use of the PPE we have available. We attempt to source alternatives, items that we would normally not apply to a situation like this, but are available, and how we can use those in place of the items we're not able to obtain, and establishing those relationships with our vendors to try to supply those items to us in bulk. We do receive assistance from the state and federal governments, as well as generous donations from everyone from major corporations to individuals. And there are signs that the supply chain is starting to recover, and we're very encouraged by that, and we hope that trend continues. And we'll be as prepared as we can be for the next wave, if there is a next wave.
And you've mentioned a phrase which we commonly use called burn rate. And just for those who may be watching, what we mean by burn rate is how quickly we'll assume for sake of this discussion, a medical professional will have to discard the gloves, mask, gown that they're wearing in order to put on fresh PPEs in order to deal with another case of infection. The gown protects and the gloves and mask protects you, the medical professional, from the infection of the patient when you're dealing with patient A. When you're ready to go to patient B, the very material that you're wearing may not be appropriate for you to wear because it now has on it infection. And so oftentimes, and there's a certain protocol by how many times you change and what you change and how frequently you change it, but that's what the burn rate is, how fast you take off this set of equipment. It's no longer usable. However many units of this have been delivered, it is now covered with infective material. It's got to be burned or disposed of properly, and you now need to put on a fresh outfit. And if somebody says that, well, how many of those might you go through in a day? It'll depend on who you're seeing and what level of contagion they have and so forth. Lots of different factors. If you walk out into the hallway with the PPE on you, having just dealt with a patient, and you bump into the wall, it's certainly possible that the COVID virus on your PPE winds up on the wall, which could be touched by somebody else coming by. So when we talk about burn rate as a phrase, that's what it means in real world terms. And when you hear organizations, nursing homes, hospitals, medical offices saying we're going through the equipment, the PPE at a phenomenal rate, that's why no matter how much we could have stockpiled in the anticipation of maybe an isolated situation at one hospital where an infection might have spread, SARS or MRSA type of thing, we would have enough to handle, there's an outbreak at a hospital. That's completely different from a pandemic that affects everybody, everywhere, all at the same time, and not just across Westchester, but across the other jurisdictions. So I want to kind of, make that sort of common sense explanation. I'm certainly not a man of medicine or science, but as you begin to understand these things, you begin to realize what a challenge it is to have the volume. It's not particularly hard to make a mask or make gloves, but the volume of those products that you need to have for all the possible people that could come in contact with a COVID patient is just, beyond calculation. And of course, what Dennis has described is the challenge that they go through in trying to obtain those things. I guess, Dennis, we should recognize that Con Edison has done us a tremendous gift by providing ultimately 40,000 masks and visors for our medical professionals. And, when you think of the surgical mask that goes across your face, that has a certain value and benefit. But if you're a medical doctor or a nurse and you're going to be dealing directly, not just perhaps happenstantially with somebody that has the virus, but somebody who is in a hospital bed very sick, the visor, the helmet and the visor more thoroughly protects you. And Con Edison did an amazing job of transforming one of their facilities into a place where they could manufacture these. And they've donated, I think we've received 6,000 already. We may have gone through those already, but I know that in the total, 40,000 of these available free of charge, which is really an amazing contribution. And obviously, we'll probably go through those 40,000 pretty quickly too, but it really is an amazing contribution along the lines of what you've just said. We've been talking with Dennis Delborgo, who is our director of our Emergency Services Operations Office of Emergency Management at our EOC. We have sat across the table from each other, walking through simulations of what might happen at Indian Point. But now we have a real life situation, Dennis, you and I and all the other professionals to deal with. And I just want to tell you how much I do personally and other members of our executive team appreciate the professionalism that you and the men and women that report to you show under the overall direction of the commissioner. As I've said many times, the people of county government who do these kinds of jobs, whether it's running a sewer treatment plant or running a bus system, the logistics of a bus system, running the airport, these are jobs that are not seen by the average everyday person. And they tend to discount what the county government does if they don't see it. They never see what goes on in the EOC. They don't even know how it benefits their life. But I do. And when I do see those things, I recognize the kind of training and the kind of dedication that you and others have shown. And even if the population at large doesn't see it and appreciate it, I do. And I want you to know how much we do appreciate what you and your colleagues have done.
Well, thanks again for having me on today. We really appreciate the opportunity to showcase that important work that these professionals here in the EOC are doing day in and day out. And we're here to help everybody get through this, and we're not leaving until the job gets done. So thanks very much again, and wish everybody well. Wash your hands, wear a mask, and we're going to get through this together.
We are indeed. Dennis Delborgo, Director of the Office of Emergency Management. He also would have added, don't touch your face, except he was watching me on video, and I must have done it happenstantially 23 times during the course of this interview. Some habits die hard. But anyway, thank you for watching Facebook Live. We'll be back at 2 o'clock for our daily update of issues here in Westchester County on Thursday, April 23rd. I'm George Latimer. Thanks for watching. Be safe.